Hello, gentlemen. If you are currently in your 50s, 60s, or even beyond those years, you may have noticed that your intimate life feels a little bit different than it used to. Specifically, I want to talk about a situation where you experience the full, intense sensation of pleasure, that peak moment of climax, but you realize there is little to no seminal fluid present afterward. If this has happened to you, please know that this message is absolutely essential for your peace of mind. Maybe it only happened one time, but it instantly caused a knot of worry and anxiety to form in your stomach. Or perhaps this is a silent, recurring issue that you have been keeping entirely to yourself because you feel a sense of shame or a quiet fear about what this might mean for your long-term health. I am Dr. William Walker, a urologist with over 12 years of experience. My entire career is dedicated to helping men stay strong, healthy, and vital at every single stage of their lives. Today, I want to have a very serious, honest, and profoundly supportive conversation with you. First, and most importantly, I want you to know that I truly hear you. The change you are seeing in your body is not a sign that your masculinity has expired, nor does it mean that your intimate life is over. Think of it this way. What you are experiencing is not a failure of your body. It is actually a very detailed message that your body is sending to you, and that message simply needs to be decoded or translated by a professional. Stay with me for the next few minutes, because we are going to explore the surprising causes, the critical warning signs you should never ignore, and most importantly, the clear and manageable solutions that modern medicine provides to bring back your confidence and your overall well-being. How your body works, the simple view. Before we dive into why the fluid might be missing, let's take a quick look at how this process is supposed to work normally. I won't use a textbook. Instead, I want you to imagine your body's reproductive system as a perfectly timed orchestra. The testicles. These are the performers. They produce the sperm. The seminal vesicles. These are like the instruments. They provide the bulk of the rich, nourishing fluid. The prostate. This adds a protective fluid to the mix. Shutterstock. All of this is gathered and prepared in a tube called the urethra. When you reach climax, your muscles contract in a powerful, rhythmic sequence to push that mixture forward and out. It is a very fast event that requires perfect timing between your nerves, your glands, and your muscles. The difference between climax and ejaculation. Now, gentlemen, there is a very important distinction you need to understand. Climax and ejaculation are not the same thing. Climax is a feeling in your brain and nervous system. It is the intense pleasure you experience. Ejaculation is the physical act of the fluid leaving the body. For most of your life, these two things happen at the exact same time, so they feel like one single event, but they are actually driven by two separate engines. Our focus today is on dry ejaculation. This is when a man feels the pleasure of the climax but notices that no fluid is released. In my office, patients often describe this as an empty orgasm. I understand that the gap between what you expect and what actually happens creates a lot of worry. You have spent your whole life expecting a physical sign of the event, but it is vital to realize your ability to feel pleasure stays intact because it is governed by your nerves and brain. The change is simply in the plumbing or the delivery system. It does not mean you have lost your strength. It just means there is a specific, identifiable reason for the change. Before we go further, if you find this information helpful, please hit the like button. It helps this video reach more men who might be worrying in silence. Subscribe to join our community, and leave a comment below. Let me know where you are watching from. I love seeing this brotherhood of men supporting each other across the world. The three main causes of dry ejaculation. Understanding why this is happening is the very first step to feeling in control again. Let's break down the three most common reasons. 1. The gatekeeper is too relaxed. Retrograde ejaculation. The most common cause is something called retrograde ejaculation. Think of your bladder as having a small muscular valve, a gatekeeper at the exit. Normally, during climax, this valve should shut tight, ensuring the fluid can only go one way, forward and out. However, if this valve is too relaxed, the fluid follows the path of least resistance and flows backward into the bladder instead of out of the penis. You feel the full pleasure, but because the fluid doesn't exit, it feels dry. The clue. You might notice that your urine looks a bit cloudy right after intimacy because the seminal fluid has mixed with it. The cause. This often happens after necessary prostate surgeries or as a side effect of medicines used for high blood pressure or an enlarged prostate. These medicines are helpful for your heart, but they can relax that tiny gatekeeper muscle. 2. The plumbing is blocked. Duct obstruction. The second reason is that the delivery pipes are blocked. Your body is still making the fluid normally, but the pipes are shut. The cause. This can happen due to scarring from past infections, like prostatitis, or sometimes tiny stones, calcifications, that block the passage. The result. The fluid volume drops or disappears completely. The good news is that a doctor can often clear these blockages with medication to reduce swelling or simple non-invasive procedures to restore the flow. 3. The fuel is low. Hormonal factors. The third area we look at is your hormones, specifically low testosterone. Testosterone is the primary fuel for the male system. It doesn't just control your desire. It is also what tells the prostate and other glands to produce the fluid in the first place. The impact. When your fuel is low, the whole system slows down. You might notice less fluid, a lower drive, feeling very tired, or losing muscle mass. This is often a condition called hypogonadism, and it is very treatable. A simple blood test can find the answer, and hormone therapy can often bring back your energy, your fluid production, and your overall quality of life. When should you see a doctor immediately? While most of the time these causes are manageable, I must tell you when to seek help right away. If dry ejaculation starts suddenly and is joined by pain during climax, blood in your urine or fluid, a fever or feeling unwell, a loss of feeling in your genital area, do not wait. These could be signs of something more serious, like uncontrolled diabetes or neurological issues, and they need a professional checkup immediately. The emotional side. You are not your fluid. We cannot ignore the emotional weight of this. Many men feel that the amount of fluid is a measure of their manhood. When it changes, you might feel inadequate or anxious. You might even start avoiding intimacy because you feel incomplete. Please hear me. This is a physical change, not a personal failure. Your ability to connect with your partner, to feel joy, and to have a healthy, intimate life does not depend on the presence of fluid. You are much more than a delivery system. Information and talking about it are the best ways to break the cycle of fear. Your action plan to take back control. Investigate, don't ignore. If you notice this change, see a urologist. It's a simple exam and usually just a quick blood or urine test to get a clear diagnosis. Watch your health. Keep an eye on things like diabetes and high blood pressure, as these affect the nerves that control ejaculation. Talk about it. Be open with your partner and your doctor. Speaking about it takes the power away from the fear and opens the door for solutions. In summary, the absence of fluid is not a verdict that your life is over. It is a signal from your body that needs to be investigated. Whether the cause is a relaxed valve, a blocked pipe, or low fuel, there are ways to fix it. Your vitality is measured by your health, your well-being, and your ability to connect deeply with those you love. Don't let doubt or shame stop you from getting answers. You deserve to feel secure and happy. If this message helped you, please share it with a friend or a family member who might be worrying in silence. I am Dr. William Walker, reminding you that your best years can still be ahead of you. Be proactive, stay confident, and stay blessed. I will see you in the next video.